Assalamu alaikum everyone. Today I am going to discuss the most important and interesting topic related to eye disease, and that is trachoma. Trachoma is also known as Egyptian trachoma or blinding trachoma. Trachoma is a Greek word which means rough. Through the definition of trachoma, we can easily understand what actually it is. It is chronic, bilateral, cicatricial keratoconjunctivitis. The word chronic means that this disease is long term. Bilateral means that it occurs in both eyes. Cicatricial means that it causes scarring. Keratoconjunctivitis indicates that there is the inflammation of cornea and conjunctiva. So actually this disease is long term, occurs in both eyes, causes scarring and the inflammation of cornea and conjunctiva. Etiology. Trachoma is caused by Chlamydia trachomatis. Chlamydia trachomatis is a bleak parasite. Trachoma is the most common cause of preventable irreversible blindness. Trachoma is the second leading cause of blindness in the world. There are type 4 hypersensitivity reaction because of chlamydial antigen involvement. Inclusion bodies of trachoma is called HP bodies, which is called Halber-Staiser-Powazaki bodies. Incubation period is from 5 to 12 days. Pathogenesis. But before discussing the pathogenesis in detail, I am going to talk about the layers of conjunctiva. So the first one is the epithelium layer, the second is the adenoid, the third is the fibrous layer. So the basic layer is epithelial infection and the subepithelial inflammatory changes. The epithelial infection occurs in the epithelium layer, while the subepithelial inflammatory changes takes place in this layer, adenoid layer. So what happens? Firstly, the organism, Chlamydia trachomatis, enters as inclusion bodies at the epithelial cells of conjunctiva and cornea. Then they enter in the adenoid layer where the lymphocytic infiltration and the formation of follicles takes place. Lastly, the follicles that are formed there are ruptured and they are replaced by scarring that result in distortion of conjunctiva and chlamydial infection. This table is very important as it helps us to understand how the transmission of chlamydial infection takes place. Genus is the Chlamydia. Chlamydia has 3 kinds of species, and among them, the one that causes trachoma is Chlamydia trachomatis. This Chlamydia trachomatis has 2 groups of serotypes. The first group is of serotype A, B, BA, and C, and the second group of serotype is from D to K. The first group of serotype causes the ocular disease, which is called hyperendemic trachoma. It is also called blinding trachoma. However, the second group of serotype is from D to K that causes the ocular disease, which is called paratrachoma. It is also called neonatal trachoma and also known as inclusion conjunctivitis. The hyperendemic trachoma causes the transmission of disease from eye to eye. However, the paratrachoma causes the transmission of disease from genital to eye. It means that it is an ocular genital infection. In this transmission, there will be the inflammation of urethra, which is called urethritis, and this urethritis is because of chlamydia, and chlamydia is the most common cause of non-gonococcal urethritis. The stages. So there are the 2 stages of trachoma. The first is the active inflammatory stage. Here you can see the active involvement. And the second stage is the cicatricial stage. As the word cicatricals means scarring, so you will observe there scars. Okay. But before discussing the stages of trachoma in detail, we have to know the basic difference between the follicles and the papillae. So follicles are nothing but the lymphoid aggregation, as you will observe there. However, the papillae are not the lymphoid aggregation, but they are the hypertrophied epithelium of conjunctiva, plus there will be stromal infiltration too. So this is the basic difference between the active stage. So this is the first stage in which you will observe the active involvement. So in this active involvement, you will observe the papillae. So what are the papillae? They are the hypertrophied epithelium of conjunctiva. The key features are the follicles. These follicles consist of lymphocytes plus MNG cells. These MNG cells are abbreviated as multinucleated giant cells, and they are also called Leber cells. Over the cornea, you will observe pannus. So what is pannus? These are the innovation of cornea or the corneal infiltration, and you will also observe there the stromal infiltration too. Over the limbus, you will observe small plaques or circles. These are called limbal follicles. These limbal follicles are also called Herbert's follicles, and later they become Herbert pits, which results in scarring. The second stage is cicatricial stage. In this stage, you will observe a scar over the upper palpebral conjunctiva, which is called Ahl's scar or line. One of the complications of trachoma is the dry eye. You will also observe corneal ulcers over the cornea. The limbal follicles over the limbus are now become Herbert's pits. That results in scarring. Another important complication of trachoma is trachiasis. What is trachiasis? These are the inward movement of eyelashes. WHO grading system, that is classified as Fisto. So in first picture there will be no infection, it's normal eye. In the second picture you will observe the follicle formation. These follicles should be numbered from 5 to or more, so that they are graded as trachoma follicles, and the size should be greater than 0.50 millimeter. Okay. Then in the second picture there will be the trachoma inflammation, and that results in scarring, trachoma conjunctival scarring. After that you will observe the trachoma trachiasis, in which there will be the inward movement of eyelashes, and end at corneal opacity. Corneal opacity over the pupil is sufficient to blur the iris details. In the second picture you will observe how the infection spread, how the active trachoma with repeated infections causes scarring, and then trachiasis, corneal opacity, and that results in blindness. Diagnosis. For the diagnosis of trachoma, there are the two methods. The first one is the clinical diagnosis, the second one is the laboratory diagnosis. So the clinical diagnosis is made if you see papillae, follicles, epithelial keratitis, corneal pannus, and if there is a presence of conjunctival scarring, as you can see in this picture. Okay. The second is the laboratory diagnosis. So it is made when we perform some test. Okay. So the first test is the ELISA test. ELISA test is done for the detection of chlamydial antibodies. PCR test is also very useful. It is called polymerase chain reaction. And the third one is the direct monoclonal fluorescent antibody. This test is used to detect the antibody from the conjunctival smear. Treatment. So there are the two methods for the treatment of trachoma. The first one is the medical treatment, and the second one is the surgical treatment. So for the medical treatment, topical antibiotics are given, such as tetracycline, erythromycin 4 times a day for 6 weeks, sulfectamide 3 to 4 times daily for 8 weeks. Systemic antibiotics are given, such as azithromycin 1 gram in a single dose per week, and erythromycin 500 mg twice daily for weeks. Antibiotics are actually given because trachoma is a bacterial infection, and to prevent the bacterial infection we have to give antibiotics. The second one is the surgical. So surgically we have to treat trachiasis. What is trachiasis? It is the inward movement of eyelashes, and to prevent their inward movement we have to do the surgical procedure. Okay. How to prevent trachoma? So for this we have to follow the safe strategy. What is actually the safe strategy? So the word safe, the S stands for surgery, A stands for antibiotics, F stands for facial cleanliness, and E stands for environmental cleanliness. Through these 4 steps, we can easily prevent trachoma. Let's end trachoma by following some important instructions like facial cleanliness and environmental cleanliness. Thank you.